Good afternoon. Bonjour à tous. Today we'll hear from Dr. Howard New and Major General Dany Fortin from the Public Health Agency of Canada, as well as Dr. Tom Wong from Indigenous Services Canada. Aujourd'hui, nous laissons la parole à Dr. Howard New, ainsi que Major Général Dany Fortin de l'Agence de la santé publique du Canada, ainsi que Dr. Tom Wong des Services aux Autochtones Canada. Dr. New, over to you.
Okay, merci, Eric. Bonjour à tous
Thank
et
you,
à toutes.
Eric. Thank you,
Good
everyone.
afternoon, everyone.
Good afternoon.
And thank you for being here. I'm joined by Major General Dany Fortin, the Vice President of Logistics and Operations at the Public Health Agency of Canada, and Dr. Tom Wong, the Chief Medical Officer of Public Health of Indigenous Services Canada. We will all say a few introductory words and then proceed with taking your questions. Today, I would like to highlight some of the developments that have occurred since our last technical briefing late December. As you may have heard earlier this week, the federal government announced that Canada has exercised its option to purchase an additional 20 million doses of the Pfizer-BioNTech COVID-19 vaccine, increasing the total amount of this vaccine that Canada will receive to 40 million doses. This development has taken into account an expected steady supply of the Moderna and Pfizer-BioNTech vaccines. It is anticipated that by September 2021, there will be enough supply to offer vaccinations to everyone in Canada for whom these approved vaccines are recommended. Another notable development this week came from the National Advisory Committee on Immunization, or NACI, which updated its guidance on the use of authorized COVID-19 vaccines. As you know, Health Canada authorizes products based primarily on the scientific and clinical information submitted by the manufacturer. The Phase 3 clinical trials were designed to assess a 2-dose vaccine series. As a result, the authorized dosing regimens are, for the Pfizer-BioNTech, 2 doses 21 days apart, and for Moderna, 2 doses 28 days apart. Public health authorities are committed to administering these vaccines as approved by Health Canada. However, there is currently a limited supply of these vaccines in Canada. The question has been raised regarding delaying the second dose in order to vaccinate and give a certain level of protection to a greater number of individuals in the priority populations with one initial dose. While NACI continues to recommend that a complete vaccine series be offered according to authorized schedules, NACI acknowledges that provincial and territorial governments will have to determine the best way to manage supply in their respective jurisdictions. NACI's analysis indicates that in exceptional circumstances, jurisdictions may consider an extended interval between doses based on current and projected epidemiological status, healthcare system capacity, and vaccine delivery and management logistics, preferably within 42 days. But I would like to emphasize that NACI's core recommendation is that the complete 2-dose vaccination series follow the authorized schedules for Pfizer, BioNTech, and Moderna. Unfortunately, the spread and impact of COVID-19 continues to increase, largely as a result of many Canadians participating in holiday gatherings. Sadly, we are now seeing rising COVID-19 case numbers, hospitalizations, and deaths. In order to get the numbers of these new cases back down, some provinces are now imposing tougher restrictions, including curfews and temporary closures of non-essential businesses. This is a difficult and pivotal point for Canadians. We all want to get out of isolation during our long, cold winter. Instead of focusing on what we cannot do now, I encourage Canadians to shift their thoughts to what we can do collectively to turn the tide on COVID-19. The most effective thing we can do as a population is to follow public health guidance on gatherings, social distancing, wearing masks, and other measures as we wait our turn to be vaccinated. We must continue to work together to conquer COVID-19. Bonjour à toutes et à tous.
Good afternoon,
Je vous
everyone.
remercie de votre présence.
Thank you for being here.
Je suis accompagné du
I
Major
am
Général Dany
joined by
Fortin,
Major General Dany
vice-président de la
Fortin, Vice
logistique et des
President of
opérations
Logistics and
de l'Agence
Operations
de la santé publique
at
du
the Public
Canada
Health
et
Agency
de
of
Dr.
Canada,
Tom Wong,
and Dr.
médecin
Tom
hygiéniste
Wong,
en chef de la
Chief
santé
Medical
publique
Officer
et
of
services
Public
aux
Health
Autochtones Canada.
of Indigenous
Nous
Services
allons
Canada.
tous faire quelques mots
We will all
d'introduction,
say a few
puis nous
introductory
répondrons
words
à vos questions.
and then proceed with taking your
Aujourd'hui, je
questions.
voudrais souligner
Today,
certaines des
I would
événements
like to
qui sont
highlight some
survenus
of the
depuis notre
developments that
dernière
have
séance
occurred since our
d'information
last
technique à
technical
la fin
briefing
décembre.
in late
Comme
December.
vous l'avez sans doute entendu plus tôt
As
cette
you may
semaine,
have heard
le
earlier this
gouvernement
week,
fédéral
the
a
federal
annoncé que le
government
Canada
announced
a
that
exercé son
Canada
option
has
d'acheter
exercised
20
its
millions de
option
doses
to purchase
supplémentaires
an
de vaccins
additional 20
contre le
million
COVID-19
doses
de
of the Pfizer
Pfizer-BioNTech,
COVID-19
ce qui porte à
vaccine,
40 millions le
increasing
nombre
the
total de
total
doses
amount of
du
this
vaccin
vaccine that Canada will
Pfizer-BioNTech que le
receive
Canada recevra. Cette décision a été prise en tenant compte
to 40
de
million doses.
l'approvisionnement
This development
régulier
has taken into
attendu des
account
vaccins de
an
Moderna et de
expected
Pfizer
steady
BioNTech.
supply of the
D'ici
Moderna and
septembre
Pfizer-BioNTech
2021,
vaccines.
l'approvisionnement
It is
devrait être
anticipated
suffisant pour
that by
administrer les
September
vaccins à toutes les
2021,
personnes
there will
au
be
Canada
enough
pour
supply
lesquelles ces
to offer
vaccins sont
vaccinations to
approuvés
everyone in
et
Canada for
recommandés.
whom these approved
Un autre
vaccines
fait
are
notable
recommended.
cette semaine concerne le
Another
Comité
notable development this
consultatif
week came
national
from
de
the National
l'immunisation,
Advisory
ou
Committee on
CCNI, qui a
Immunization,
mis à jour ses orientations sur
NACI, which
l'utilisation
updated
des
its
vaccins
guidance on the
autorisés
use of
contre la
authorized
COVID-19.
COVID-19
Comme vous le
vaccines.
savez,
As
Santé
you
Canada
know,
autorise
Health
les
Canada
produits en se fondant
authorizes
principalement
products
sur les
based
données
primarily on the
scientifiques et
scientific
cliniques
and
fournies par
clinical
le fabricant.
information
Des essais
submitted
cliniques
by
de
the
phase 3 ont
manufacturer.
été conçus
The phase
pour
3 clinical
évaluer une série de
trials
vaccins
were
à 2
designed
doses.
to assess
Par
a
conséquent,
two-dose
les
vaccine
schémas
series.
posologiques autorisés sont les suivants.
The authorized dosing regimens are
Pfizer-BioNTech, 2
Pfizer
doses à
BioNTech,
21 jours
2 doses
d'intervalle.
21 days
Moderna,
apart.
2 doses à
Moderna,
28 jours
2
d'intervalle.
doses 28 days
Les
apart.
autorités de santé publique se sont
Public
engagées
health
à
authorities
administrer
are
ces
committed
vaccins
to
approuvés par
administering
Santé
these
Canada.
vaccines as approved
Toutefois,
by Health
en raison de
Canada.
l'approvisionnement
However,
limité de ces
there
vaccins
is
au Canada,
currently a
la
limited supply
possibilité
of
de
these
reporter
vaccines
la
in
seconde
Canada.
dose a été
The
évoquée
question
afin
has been
de
raised
vacciner
regarding
le plus
delaying
grand
the second
nombre
dose
de
in order
personnes
to
faisant
vaccinate
partie
and
des
give a certain
populations
level of protection
prioritaires et de
to a greater
conférer
number
un
of
certain niveau
individuals
de
in the
protection
priority
grâce à une
populations
première dose.
with one
Bien que
initial
le
dose.
CCNI continue de
While
recommander qu'une série
NACI
complète de
continues
vaccins
to
soit
recommend
offerte
that a
selon les
complete vaccine
calendriers
series be
autorisés,
offered according
il
to
reconnaît
authorized
que les
schedules,
gouvernements provinciaux et
NACI
territoriaux
acknowledges that
devront
provincial and
décider
territorial
de la meilleure
governments will
façon
have
de
to
gérer
determine the best way
l'approvisionnement au
to
sein de
manage
leur
supply in
administration.
their respective
D'après l'analyse de
jurisdictions.
CCNI, dans des
NACI's
circonstances
analysis indicates that in exceptional
les autorités
circumstances,
peuvent envisager un
jurisdictions
intervalle
may
prolongé
consider
entre
an
les doses
extended
en fonction de la
interval
situation
between doses based
épidémiologique
on
actuelle
current
et prévue,
and
de la capacité
projected
du système de santé
epidemiological
et de la
status,
logistique de
healthcare
livraison
system
et de gestion des
capacity,
vaccins,
and
de
vaccine
préférence
delivery
dans un délai
and
de 42
management
jours.
logistics, preferably
Je
within
dois
42
toutefois
days.
souligner que la
But
recommandation
I would
clé
like
de
to
CCNI
emphasize that NACI's
préconise la
core
série de
recommendation
vaccins
is
complète
that
à
the
2
complete
doses selon
two-dose
les
vaccination
délais
series
prescrits de Pfizer,
follow the
BioNTech et
authorized
de Moderna.
schedules for Pfizer and Moderna.
Malheureusement, la propagation et
Unfortunately,
l'incidence de la
the
COVID-19
spread and
continuent
impact of
d'augmenter chez les
COVID-19
Canadiens.
continues to increase
Cela
in
est
Canada,
grandement attribuable aux
largely as a
rassemblements qui ont
result
eu
of
lieu pendant les
many
fêtes.
participating in holiday
Regrettablement, nous
gatherings.
constatons maintenant une
Sadly,
augmentation
we
du
are now
nombre de
seeing
cas de
rising
COVID-19,
COVID-19 case numbers,
d'hospitalisations et de décès.
hospitalizations, and
Afin
deaths.
d'apaiser le nombre de nouveaux
In
cas,
order to get the
certaines
numbers of new
provinces
cases
imposent
back
désormais
down,
des restrictions
some
plus strictes,
provinces are now imposing
notamment
tougher
des
restrictions,
couvre-feux
including
et des
curfews
fermetures temporaires
and temporary
d'entreprises non
closures of
essentielles.
non-essential
Il s'agit
businesses.
d'un moment difficile et crucial
This
pour les
is a
Canadiens.
difficult and
Nous
pivotal
voulons
point
tous
for
sortir de
Canadians.
l'isolement pendant notre
We all
hiver
want to get
long
out of
et froid.
isolation during a long,
Au lieu de
cold
penser
winter.
uniquement à ce qu'il est impossible de
Instead
faire
of
en ce
focusing
moment,
on what we
j'invite
cannot
les
do
Canadiens
now,
à
I
réfléchir à
encourage
ce que nous
Canadians to
pouvons faire
shift their
collectivement
thoughts
pour
to what we
renverser la
can do
tendance
collectively to
liée
turn
à
the
la
tide
COVID-19.
on
La
COVID-19.
chose la plus efficace que
The
nous
most
puissions
effective
faire
thing
à
we can
l'échelle de la
do
population
as a
est de
population
suivre le
is to
Conseil de santé
follow
publique
public health
relatif
guidance
au
on
rassemblement,
gatherings,
à la distanciation
social
sociale
distancing,
et au port du masque entre
wearing
autres mesures
masks,
en
and
attendant
other
notre
measures
tour
as
d'être
we wait our
vaccinés.
turn to be
Nous devons
vaccinated.
continuer à
We
travailler
must continue
ensemble
to work
pour vaincre
together
la
to
COVID-19.
conquer
Et maintenant, je
COVID-19.
passe la parole
Now
au
I'll
Major
give the
Général
floor to
Fortin,
Major General
et après son
Fortin,
intervention,
and after his
nous
remarks,
passerons
we will
à
hear
l'allocution de Dr. Tom
from
Wong.
Dr. Tom Wong.
Merci beaucoup. Bonjour à
Thank you
toutes
very
et à
much.
tous.
Good afternoon,
La livraison de
everyone.
vaccins se
The
poursuit
delivery of
partout au
vaccines
Canada
across Canada
aujourd'hui, cette semaine, avec
continues
plus de
with more than
380 000
380,000 doses
vaccins
of COVID-19
COVID-19
vaccines
livrés aux provinces
being
et aux
delivered to
territoires.
provinces and territories this
D'ici
week.
demain, nous prévoyons
By
donc
tomorrow,
atteindre
we
un
expect
total
to
de
have distributed a
929
total
000
of
doses au pays.
929,000
Tous les
doses in the
vendredis, les
country.
livraisons confirmées
Confirmed
sont
deliveries
mises à
are
jour sur le
updated
site
on the
web
government of
du
Canada's
gouvernement du Canada.
website every
De plus,
Friday.
nous avons maintenant affiché
As
les
well,
prévisions
we have
jusqu'à
now
la fin de
posted the
février,
allocation
fournissant
forecast
ainsi
to
les
the end
quantités
of
prévues de
February,
vaccins qui seront livrés
providing
à
the
chaque
expected
province et à
quantities
chaque
to be
territoire.
delivered to each province and
Les
territory.
vaccins de Pfizer-BioNTech sont livrés chaque semaine La livraison cette semaine est de
Pfizer-BioNTech
208
vaccines are
650
delivered every week.
doses.
This week's
Nous recevrons
shipment
les
is
mêmes
208,000
quantités de
doses,
vaccins
and we will receive the
Pfizer-BioNTech
same
pour les
quantities
autres
of
semaines qui restent
Pfizer-BioNTech
en
vaccine
janvier.
doses for the
Pour le
remaining
mois de
weeks of
février,
January.
nous attendons à
For
recevoir un
February,
total de
we
1,4
currently
million de doses
anticipate a total of
lors du mois de
1.4 million
février.
doses in
En ce qui
February.
concerne les doses du vaccin
As for
Moderna,
the Moderna
l'envoi de cette semaine est
vaccine
de plus de
doses,
171 000
this
doses.
week's shipment
C'est la
is
deuxième
more than
livraison de vaccin Moderna.
171,000
Elle est
doses,
distribuée
and the second
aujourd'hui et demain
shipment
aux
is being
provinces et
distributed today
territoires.
and tomorrow for the provinces
Les
and
envois de
territories.
vaccins Moderna arrivent, comme
Moderna
j'ai dit
shipments,
précédemment,
as
toutes les
I
3
said before,
semaines,
will arrive
avec des
every
quantités de
3
livraison
weeks
de plus en plus importantes.
in increasingly larger
Au cours de la
deliveries.
première semaine de février,
During
nous
the first
recevrons
week of
230
February, we will receive
400 doses. Elles sont suivies d'un envoi de
230,400
taille
doses,
similaire dans la semaine du
and it
22
will be
février.
followed by shipment of similar
Nous
size
sommes
in the week of
continuellement en dialogue
22nd
avec les deux
February.
fabricants de vaccins
We are in
et
constant
nous
dialogue with
attendons
both
à
vaccine
recevoir sous peu la
manufacturers, and
confirmation
we
de
expect
répartition des doses
the
au
precise
cours du mois
allocations
de
for
mars.
March to be confirmed soon.
Maintenant, quelques mots à propos de la
A
prochaine
few
phase.
words about the next phase.
Le prochain trimestre. La
The
phase
next
2,
quarter,
qui est aussi appelée
phase
la
2,
phase
also
d'accélération.
referred to as the
À
ramp-up
compter
phase.
du mois d'avril, la
As
quantité
from
de doses
April,
arrivant
the
au
quantity
Canada
of
devrait
doses
dépasser
arriving
en
in
moyenne
Canada is
1 million de
anticipated
doses
to
par
average
semaine
more than 1 million
pour
doses
les
per
deux
week
vaccins actuellement homologués.
for the
C'est à partir de ce
two
moment que nous
vaccines
passerons
now
à la phase 2.
approved.
L'équipe de
This
planification
will signal
logistique
our transition
collabore
into
avec
phase
les
2. The
partenaires
logistics
fédéraux,
planning team is
provinciaux,
working with
territoriaux et
federal,
autochtones
provincial,
partout au pays
territorial, and
afin de
indigenous
synchroniser la
partners
disponibilité
throughout the
prévue de
country
vaccins
to align
avec la capacité
forecasted vaccine
d'immunisation dans les
availability with
provinces et
the
territoires.
immunization capacity in the
Nous
provinces
assurons
and
que toutes les
territories.
exigences supplémentaires
We are
d'équipement
ensuring that any
permettant
additional
d'assurer la chaîne du
requirements
froid,
in
les
terms of
fournitures
cold
de base
chain
et de
enabling
soutien à
equipment,
l'entreposage soient
ancillary
déterminées
supplies,
tôt
and
afin qu'elles
support to
soient en
storage
place
and
pour
distribution
recevoir
are
les envois les
identified
plus
early
importants.
and are in place for the
Il est
larger
essentiel de
deliveries.
communiquer de façon claire
Clear
avec les partenaires et
communications
les
are key
intervenants,
to
s'assurer qu'on
ensuring
a
that
tous la même
partners and
vision de la
stakeholders
planification,
have
de
a
la
shared
répartition
understanding of
des
planning
et des
allocations
considérations.
and
Nous partageons
considerations.
donc des documents
We
de
will be
planification
sharing
de la phase 2 avec les
phase 2
provinces et
planning
territoires
documents with
au cours des
provinces
prochains
and
jours
territories in the
et les
coming
prochaines
days and
semaines afin de
weeks
nous assurer
to ensure
d'avoir tous
they
la
continue
même image
to
et
have
d'avoir les renseignements
the
les plus récents qui nous
latest
permettent de
information
bien
and the same
planifier
picture of the
le
situation so
vaccination.
that we can better plan
Alors, si nous
vaccination.
prenons en compte les vaccins déjà homologués,
Taking into
comme il a été
account
précédemment
approved
indiqué,
vaccines,
nous
as I said before,
nous devrions
we
recevoir
anticipate
20 millions de doses du
receiving
vaccin au
20
cours du
million
deuxième trimestre.
doses during the
Les
second
deux vaccins.
quarter for the
Nous
two
continuons à
vaccines.
travailler avec les services
We continue
publics
to work with
Approvisionnement
Public
Canada, nos
Services and
collègues,
Procurement
ainsi
Canada,
qu'avec les fabricants pour
our
maximiser la
colleagues and
disponibilité de
manufacturers to maximize
afin
vaccine
que le plus grand nombre de
availability so
Canadiens
that
soient
as many
vaccinés le plus
Canadians as
rapidement
possible
possible
can
au
be
cours de l'année.
safely vaccinated as quickly as possible.
Good afternoon. The delivery of vaccines across the country continues with more than 380,000 doses of COVID-19 vaccines being delivered to provinces and territories this week. By tomorrow, we expect to have distributed a total of 929,000 doses. Confirmed deliveries are updated on Government of Canada's website every Friday. As well, we have now posted the allocation forecasts for the end to the end of February, providing the expected quantities to be delivered to each province and territory, allowing them to plan in detail. The Pfizer-BioNTech vaccines arrive on a weekly schedule. This week's shipment is 208,000, and we will receive the same quantities of Pfizer-BioNTech vaccine doses for the remainder of January. For February, we currently anticipate a total of 1.4 million doses to be delivered. Now with Moderna, regarding that vaccine, this week's shipment of more than 171,000 doses is currently underway. It's the second shipment, and it's being distributed today and tomorrow, pending any weather issues, to provinces and territories. Moderna shipments will arrive every 3 weeks, as previously mentioned, in increasingly larger deliveries. During the first week of February, we'll receive 230,400 doses, and it will be followed by a shipment of similar size in the week of 22 February. We are in a constant dialogue with both vaccine manufacturers, and we expect the allocations for March to be confirmed soon. Now, a word about phase 2, the next quarter, also called the ramp-up phase. The quantity of doses arriving in Canada is anticipated to average more than 1 million doses a week for both currently approved vaccines, starting in April. This will signal our transition into this ramp-up phase. The logistics planning team at the agency is working with federal, provincial, territorial, and Indigenous partners to align forecasted vaccine availability with the immunization capacity in the provinces and territories. We're ensuring that all additional requirements in terms of cold chain enabling equipment, ancillary supplies, and support the storage and distribution are identified early and are in place for the larger deliveries. Clear communications are key to ensuring that partners and stakeholders have a shared understanding of planning, allocations, and considerations. So we'll be sharing phase 2 planning documents with provinces and territories in the coming days and weeks to ensure that we all have the same picture and we continue to have the latest information. Based on approved vaccines, we anticipate 20 million doses for the second quarter. We continue to work with our Public Services and Procurement Canada colleagues and with manufacturers to maximize the vaccine availability so that all Canadians, as many Canadians as possible, can be safely immunized as rapidly as possible in the year. Thank you very much, and I'll hand it over to my colleague.
Bonjour. Je tiens d'abord
Good afternoon.
à
First of all,
reconnaître que
I would
nous
like to
trouvons sur le
acknowledge the
territoire
fact that
non
we are on
cédé
the
du
unceded
peuple
territory of the Algonquin
I want to
people.
acknowledge that I am on the unceded territories of the Algonquin people. There has been significant progress made in terms of federal, provincial, territorial, Indigenous engagement. I'm happy to see that co-planning with Indigenous partners is increasingly taking place, and I look forward to the progress across the country. Various First Nations, Inuit, and Métis communities across the country have started immunization blitzes. For example, BC vaccine rollout has begun in 18 northern communities, and Alberta has started vaccine rollouts in long-term care and elder facilities in Indigenous communities. Recently, First Nations and Manitoba jointly announced 5,300 doses for high-needs northern First Nations communities. And Saskatchewan has mobilized close to 5,000 doses for northern First Nations and Métis communities. In Ontario, Quebec, Atlantic, and the territories, communities have started vaccine rollout, which include elders' lodges and long-term care facilities. One thing that's amazing, is Elder Helen Clifton in Gitsat First Nations in BC posted a very powerful message on social media explaining why she chose to be vaccinated, and she wants to be a role model to protect herself and her loved ones. While immunization is a personal choice, I would like to take this opportunity to reiterate that by getting immunized, elders and us will be better protected and will help prevent the spread of the virus in Indigenous and other communities. Malgré les rôles différents que nous devons
In spite of the
tous jouer
different roles
pour
we all have
assurer
to play
un accès équitable
to
aux
ensure
vaccins,
equitable access to
il est
vaccines,
essentiel
it is
que nous
essential
travaillons en
that
collaboration
we work
pour soutenir
together
les Premières Nations,
to
les
support
Inuits
First
et les
Nations,
Métis.
Inuits, and
Nous
Métis.
savons que chaque collectivité
We know
a des
that
forces
each
et des
community
besoins que
has
leur sont
strengths
propres.
and needs that are
We have been
specific
working
to
with
them.
First Nations, Inuit, and Métis vaccine champions to develop messaging and public service announcements in different languages that are culturally safe and mindful of the needs of distinct Indigenous communities. I look forward to the continued collaboration of federal, provincial, territorial, Indigenous partners to mobilize vaccines to keep everyone safe. Miigwech, nakumik, merci, merci, and thank you. Moderator.
Thank you, Dr. Wong. We will now open the telephone line to questions. Vous pouvez poser vos questions dans l'une des deux langues officielles.
You can
We ask
ask
that you
your
limit yourself to one
question
question
in
and
any of
one
the
follow-up.
official,
For those asking
languages.
questions in the room, we ask that you make your way over to the freestanding mic. As usual, we'll start on the phone for 2 questions and turn over to the room. Operator, over to you.
Thank you. Merci. If you have a question, please press star 1. Si vous avez une question, faites étoile 1. The first question that we have is Raymond Fillon from TVA. Please go ahead. La parole est à vous.
Merci beaucoup. Bonjour à tous.
Question.
On nous
Thank
dit
you very
aujourd'hui que le
much.
gouvernement
We
du
are being
Québec va
told today that the
annoncer que
Quebec
la
government
seconde
will
dose des
announce that
vaccins
the
pourrait être
second dose of
retardée
vaccines
jusqu'à
could be delayed
90 jours
up
après la
to
première. Vous avez
90
parlé des
days after the
recommandations tout à
first. You
l'heure.
talked
Alors,
about
qu'est-ce que vous pensez
recommendations
de
a while
cette
ago. What do
possibilité-là?
you
Un
think
délai
of
de
this
90 jours,
possibility?
c'est beaucoup plus que
A
les 42
delay
jours
of
maximum
90 days.
recommandés.
This is more than the 42 days
Merci
maximum
pour la
recommended.
question. Ça, c'est Dr.
Answer.
New.
Dr.
Comme
No
j'ai
here.
constaté,
Thank you for the question.
les deux vaccins
The two
homologués au
vaccines
Canada
that are approved in Canada
sont approuvés selon les données probantes
were approved
des
based
essais
on
cliniques soumis
scientific
par
data
les
and
entreprises
clinical
Pfizer, BioNTech et
information
aussi Moderna.
provided by
Et tous
Pfizer,
les
BioNTech and
médecins
Moderna.
hygiénistes en chef du
All
Canada,
chief medical
c'est mes
officers of
homologues, mes collègues
Canada,
de
my
la santé
counterparts
publique, on est tous d'accord.
working in public health
On
all
fait nos
agree
meilleurs efforts pour
we are doing the best
respecter,
we
pour
can
suivre les recommandations
to
pour
follow
l'administration des
recommendations
vaccins.
when it comes to
Mais
administering the
c'est un
vaccines.
enjeu parce que
This is
la
an
quantité
issue
des
because
vaccins
the
sont limitées
quantity
actuellement
of
au
vaccines
Canada.
are now
Et
limited in
aussi dans
Canada
quelques régions du
and
Canada,
in some
incluant
regions
le
of Canada,
Québec,
including Quebec.
La pandémie a intensifié
The
beaucoup plus
pandemic
des cas aussi,
has
des
intensified
hospitalisations
and
aussi,
there
des
are
décès.
more
Donc,
cases,
ça,
more
c'est vraiment un enjeu.
hospitalizations
Et
and more deaths. So
ce que
that
le
is really an issue.
CCNI a fait,
What NACI
c'est
has
analyser
done
les données
is
probantes disponibles à
analyze
date. Il n'y a pas
scientific
beaucoup
data
de
available
données
to date.
pour
There's
un
not much
intervalle
data
plus de
available when
42
it comes
jours.
to intervals
Mais aussi,
beyond
c'est
42
même
days.
enjeu à l'échelle
But it's the
mondiale
same
parce que
problem
l'OMS aussi,
globally
avec leur
because
comité des experts,
WHO, with their
aussi
committee of
a
experts,
effectué une analyse
have
des données
also
probantes
analyzed
à
the
date et ils
scientific
ont
data
fait les mêmes
available to date, and they have made the
avec
same
les
recommendation
données disponibles.
with
On
available
peut
data.
recommander que
We
pour
can
l'efficacité
recommend that
pour
to
l'intervalle
ensure
des deux
the
doses,
effectiveness
on
when
a
it comes
assez
to
de données pour dire que
intervals
oui,
between the 2 days.
c'est
Based on
efficace
clinical
si
data,
on
it is
fait un intervalle
effective
jusqu'à 42
if
jours.
we go up to
Après
42
jours,
days. After
on
a
ne sait pas, on n'a pas
42-day
des
interval,
données.
we do not have
C'est sûr
any
que
data.
le gouvernement de Québec va prendre sa propre décision
Of course,
concernant
the Quebec
l'administration
government
des
will be
vaccins.
taking its own decision when
C'est
it
sûr
comes
aussi
to
que c'est
administering the
très
vaccines.
important que si le
We
gouvernement
also know
du
that it's
Québec
important
va
that
peut-être même
if the Quebec
avoir un autre
government
intervalle, que c'est important de requérir les
adopts
données
this other
pour vraiment
interval, it is
évaluer c'est quoi
important
l'efficacité
to
leur
collect more
programme de
data
vaccination.
to
Aussi,
monitor
aujourd'hui,
the
je pense que
effectiveness
bientôt,
of its
peut-être c'est
program.
déjà publié.
Very soon,
On a
maybe
aussi
this is published already.
comme une déclaration du
There
Conseil
will be a
des médecins
declaration
hygiénistes en chef
from
de tout
the
le Canada,
Committee of
incluant
Chief
Dr.
Medical
Arruda du
Officers
Québec.
of Canada,
Donc,
including
je vous
Dr.
peut-être
Arruda from
propose
Quebec.
aussi de lire
So
cette
please, I
déclaration.
invite you
Merci.
to read that declaration. Thank
Merci,
you.
Dr. New. Ray, follow-up?
Thank you, Dr. No.
Oui, donc c'est
Follow-up
au-delà de
question.
90
So
jours,
beyond
le vaccin pourrait ne
90
plus être
days,
efficace. C'est ce que vous
the
êtes en train de
vaccine
dire.
may
C'est
no
ça le
longer be
principal
effective.
problème, ou il y a
Is that what you're
d'autres
saying?
problèmes
Is
qui
that the
pourraient
main problem?
survenir, notamment au
Or
niveau de
may
l'approvisionnement?
other problems arise when it comes to
Ce que j'ai
supplies?
dit qu'on a
Answer.
seulement les données
What I
probantes à
said is
date
that
pour
we only
pour
have
dire que
scientific data
l'efficacité peut-être
so
c'est
far
semblable
to
avec
be able
ce
to
qu'on
say
on
that
sait déjà avec
effectiveness
toutes
may
les
be
données
similar
probantes
to
pour
what we already
l'intervalle
know
21 jours ou 28 jours,
when
c'est
it is
pour
21
les
to
deux vaccins.
28
Si on fait jusqu'à
days in
42
interval.
jours,
If
on
we
a
go up
assez
to
de données
42
probantes
days,
pour
we have
dire,
enough
OK,
scientific data to
peut-être
say,
ça
well,
marche et
maybe it could also
l'efficacité
work.
des vaccins, c'est semblable.
The effectiveness of the
Après, à
vaccines
42
is
jours, on
similar,
n'a
but
pas
after
des
42
données
days,
disponibles
we
pour
do not
faire une
have any
évaluation
data
pour dire c'est quoi
available to be able
l'efficacité.
to make that assessment as to its
Chose aussi, je peux
effectiveness.
dire,
There's
avec
something else
notre
I would like to
expérience
say,
avec des
given
autres
our
vaccins,
experience with other
on sait des
vaccines.
fois c'est plus important
We know that
avec un
sometimes
intervalle recommandé de pas, comme il dit,
it is important with a
avoir un
recommended interval.
plus petite. Si ça recommande, je parle de notre vaccin.
Well, I'm
peut-être
talking about other
l'intervalle, c'est 2
vaccines.
mois.
Maybe an interval
C'est sûr,
is 2
si on
months.
peut attendre 2 mois, c'est
If you
idéal.
can wait
Mais si
2
on
months,
attend
it's
peut-être même
ideal.
3 mois,
But if you
peut-être
wait 3 months,
quelques semaines même plus longues,
a few
c'est
weeks
correct.
longer, it's
Mais
okay.
plus courte, moins de 2 mois, c'est
But
pas
less than 2
recommandé.
months
Parce
is
que
not recommended.
pour le système immunitaire, pour vraiment
Because
avoir une, comme on dit, une
the
réponse
immune system needs
qu'on veut pour les
time
anticorps,
to
tout ça,
have
c'est ça
the
ce que,
reactions we are
c'est ça
expecting
notre
from the
expérience.
antibodies.
Donc,
That's
je peux
our
pas dire parce que
experience.
c'est vraiment des nouveaux
So I
vaccins.
really
Tout le
cannot
monde
say
dans le
because
monde
these are new
regarde
vaccines.
qu'est-ce qui se passe actuellement
We all
avec,
have to look at what is
avec
happening
notre expérience collective à vacciner
with our collective
la
experience compliance
mondiale.
with
Pour l'instant,
vaccinating the
on
global
recommande
population.
de
For
suivre
now, we are
comme
recommending
l'intervalle de recommander
respecting
avec
the
Santé
recommended
Canada, mais
interval
si
as
on veut
recommended by Health
prolonger,
Canada. If we
c'est sûr
want
que
to
c'est
extend
important
that
d'aussi
interval,
recueillir
it's also
données
important to collect
pour analyser c'est
related
quoi
data to be
l'efficacité
able to
des
analyze the
programmes. Merci.
effectiveness of the vaccination
Merci
programs.
beaucoup.
Thank you.
English generally. Okay. Starting from the beginning, not the relevant part. Okay. The two vaccines recommended, approved in Canada, were based on the data that was submitted by the manufacturers, and we know what the effectiveness is, or at least the efficacy for a dosing interval of 21 and 28 days, depending on the vaccine you're looking at. And certainly all of the public health authorities in Canada are on the same page. And actually, there's a statement that's been put out. I think it's actually out in the public domain. It's worthwhile looking at that. We're all committed to following the schedule, certainly the spirit of the schedule as recommended by the manufacturer. But there's also some realities on the ground. The fact is that the supply in Canada is limited at the present time. Certainly, we expect that it will improve in the future, and we'll have lots more vaccine, and this won't be the same issue as we have right now. But we do have a limited supply, and because in many parts of the country, the pandemic is getting worse. So we see that the rates of infection increasing, hospitalization, and deaths as well. And so the question has arisen whether it is an appropriate program, operational decision to actually increase the interval. And the question is, do you then protect more people with an initial dose with a certain level of protection, as opposed to following to the letter and vaccinating maybe a smaller number of people with the 2 doses with the recommended interval? And that question is not something that's just unique to Canada. It's actually obviously an issue worldwide as well. The WHO has also had its expert committee weigh in on the issue, because in many other countries it's the same as in Canada. And they've come forward with a recommendation, and that's the same as our NACI. They've looked at the same data that's been available and said, based on the data that's available, certainly increasing the interval, only under exceptional circumstances, as we've gone over, the efficacy of the vaccine should be the same up to 42 days. After 42 days, we really don't know. There's no data there. So if provincial or territorial vaccination programs make the decision to consciously go beyond 42 days, I think it'd be very important, and the understand is, to actually collect data, to actually monitor the populations, to see what the overall effectiveness is of the vaccine in the vaccinated populations, based on maybe a different interval in their vaccination schedule.
Thank you very much. Operator, next question.
Merci. Thank you. The next question is from Ryan Tumulty from the National Post. Please go ahead. Your line is now open. Votre ligne est ouverte.
Yeah, good afternoon. We've heard a number of the provinces, Ontario and Alberta in particular, talking about potential shortages of vaccine. I'm wondering to start with if you've, at any point since this rollout started, missed any of the sort of delivery quantities that you set out when you set out to deliver, 171,000 Moderna, for example. Have you at any point missed that? And I'm wondering what you make of the provinces, I guess, potentially setting themselves up to have shortages by booking more appointments than they have supply.
Yeah, it's Maj Gen Fortin. I think I've answered that in the past, but we have a scarcity of vaccines in the first quarter. We expect to have up to 6 million doses. We're still working the final detailed schedule for March with the manufacturers. We have been sharing data with provinces and territories who, of course, understandably want more vaccines as they ramp up their vaccination programs. The challenge is we have limited quantities. We'll have significant, big jump in the second quarter, and we'll be able to distribute much larger quantities and vaccinate at scale. But the rub is right now, as clinics are starting to ramp up, there's this perhaps disappointment with relatively small numbers when it gets distributed. And I know that provinces and territories are very much paying attention to that rollout so that they have manageable quantities distributed to the right locations to avoid exactly what you just described. A sense that we don't have enough and we had clinics or appointments scheduled and we have to cancel. Quantities are available, quantities are known, I should say, to provinces and territories, and I trust that it's going to get, all those little wrinkles will get ironed out in a rollout so that provinces, territories, and the various stakeholders have more and more confidence in the system, more and more visibility in what's coming next. Alors, en français, je vous dirais que
In French,
les quantités de vaccins disponibles
answer repeated in
lors du
French.
premier
The
trimestre
quantity of vaccines
sont limitées, comme j'ai déjà
available during the
mentionné
first
par le passé.
quarter are limited.
On a une
As I
augmentation
said before,
significative
there's
en
been
avril.
there was a
Et
significant
encore
increase
élevé.
in April.
Alors,
And
les provinces,
in the
territoires
summer,
ont
provinces and
visibilité sur les quantités
territories
qui
have
vont
visibility
s'attendre à
on
recevoir en janvier,
quantities
en
they
février.
expect to
On
receive
est
in
encore en
January
train
and
de travailler sur le
February.
détail
We
pour
are still
mars.
working on the details for March.
Il y a une demande mondiale.
There's a
Tout
global
le monde a
demand.
tous les manufacturiers s'efforcent de
All
fournir les quantités
manufacturers
prévues
are
selon leurs
trying
échéanciers.
to supply
Mais bien entendu, il peut y
what they're
avoir
supposed to
un peu
supply as scheduled.
de difficulté à
There's still
harmoniser
some difficulty harmonizing
la croissance,
the
l'augmentation du nombre de cliniques, la quantité
in
de
clinical
personnes pour
numbers, the number of
vacciner
people to vaccinate.
un manque de vaccins
There's a lack
un peu partout. Alors,
of vaccines almost
j'ai
everywhere.
confiance que les provinces et
I
territoires
believe the
et
provinces and territories
les différentes parties prenantes
and the different
sont tous
stakeholders
en train de regarder cette situation
all
et d'ajuster leur processus.
monitoring the situation and adjusting their
Merci.
processes.
Question suivie.
Thank you. Follow-up question?
Yeah, just as a follow-up, you mentioned that starting in the second quarter, you expect to see doses of up to a million or more a week. In the first part of this month, we saw a little bit of a struggle for provinces to keep up with the deliveries that you were doing. We saw some vaccines sitting in freezers. I'm wondering if you hope that by the time we hit April that we won't hit that problem again when we ramp up supply, that the provinces will be able to, take in those million doses a week and administer them quickly, because I imagine there's only so much storage capacity for them as well.
Yes, thank you. I don't think the storage capacity is a problem. I think that as we expect in provinces, territories, and in the federal stakeholders, as we expect quantities with the right, as we have visibility on the expected deliveries, we can plan accordingly, turning on, turning off the various vaccine delivery sites, aligning the right resources in terms of freezers, different types at every location and all the necessary equipment. More importantly, line up the health workforce to immunize. There's already indications in our conversations with our partners that there are thousands and thousands of volunteers out there that raise their hand and say, hey, call me up when it's time, and whatever province and territory that is. So across the country, there are lots of people stepping forward, ready to vaccinate. So I am optimistic that we have everything lining up in the provinces and territories to vaccinate at scale as larger amounts arrive in this country.
Thank you, Major General Fortin. We'll now turn into the room here for two questions. First question, Globe and Mail.
Yeah, Marika Welsh with the Globe and Mail. I think this is for Dr. New. We're seeing reports from Quebec of nursing home residents who got the first shot of the vaccine and then developed COVID-19. Have you received reports of this happening anywhere else, or is Quebec the only place this has happened so far in Canada?
I can just say personally, I'm only aware of the reports that obviously have been in the media as well about those individuals. I can't say much more. I don't have more of the details of that particular situation. what I would say, it's interesting is that not specifically referring to the situation, is that it sometimes could well be that an individual who is asymptomatic and gets a first dose of the vaccine may well have already been infected. And by the time, a week or so has passed after that first vaccination, they actually then obviously develop symptoms and then get diagnosed with COVID-19, which has nothing to do with sort of the vaccination per se. So it's just sometimes a timing issue. I really don't know much more. And obviously, I'm sure the authorities in Quebec are investigating further. Thank you. Oh, okay. Oui.
Answer in
J'ai
French.
vu qu'est-ce qui se passe actuellement dans les quelques
I've seen
CHSLD
what
au
is happening
Québec
in some
avec,
long-term care
avec des
facilities in
résidents.
Quebec
Et je peux
with
dire que
residents. What I can
on ne
say
sait pas, c'est sûr
is
que
that
les autorités du
we
Québec
don't know. I'm
vont faire
sure
une
that the
enquête
Quebec authorities will carry out investigations
analyser c'est quoi la
to
situation.
analyze
Ce
the
que je peux
situation.
vous dire, c'est que
What I can
c'est
say is
toujours une
that
possibilité que
it
quelqu'un
is
en
possible,
général
and this is a
peut
general
être asymptomatique,
proposition,
peut
that someone may
recevoir
be
le vaccin,
asymptomatic,
et puis peut-être
receive the
quelques jours
vaccine,
après,
and a few
peut développer des
days
symptômes
develop
et puis après être
symptoms
diagnostiqué avec la
and
COVID-19.
then be
C'est rien
diagnosed with
à faire avec
COVID-19.
la
It has nothing
vaccination,
to do
c'est
with the
seulement une
vaccine.
question, comme on dit en anglais, de timing.
It's
Merci.
all a matter of timing.
And I'm just wondering though, first of all, it was my understanding that Public Health Agency of Canada is supposed to get this information to do this tracking to see the efficacy of the vaccine, but also any side effects. So is that not being sent to you if you're only seeing it in the media? And does this suggest that the 90 days might be too long in Quebec? Does it suggest a need to get that second dose in faster?
To your question about tracking, yes, all of the provinces and territories have tracking systems in place. There's good communication between the provinces and territories and ourselves at the federal level in terms of sort of the administration. I think we've already put forward. I think there's going to be a public-facing, I think, sort of a website that will obviously over time. I think I have a richness of data in terms of vaccines distributed, et cetera, and so on. We're also receiving reports, certainly, of adverse events, certainly where we're tracking that. And certainly we understand that at the provincial level, that for any adverse event, there's certainly going to be an investigation done because sometimes it's a temporal issue. Sometimes, there could be something that obviously needs to be looked into further. The question about getting COVID-19 with respect to sort of the vaccination and the timing, that's something else we looked at. Certainly, we've been focused in terms of adverse events, in terms of the usual, anaphylactic reactions or anything more serious. But yeah, it's definitely, we're getting those reports on a regular basis from the provinces and territories.
Thank you. For the next question, CTV.
Hi, Dr. New. Mackenzie Gray with CTV. Ontario put out a fairly detailed plan yesterday about their vaccination rollout, and they are saying that they're going to be vaccinating essential workers ahead of 80-year-olds. Previously, when we've asked Dr. Tam about this, she said that the focus should be after we deal with healthcare workers and folks in long-term care homes, the most effective approach is to start vaccinating by age. 85, 80, 75, 70, and go down that way instead of focusing on specific groups. What's your take on that?
What I would say to start off is that I think everyone in the country is well versed in terms of the four priority groups that NACI has articulated, and certainly I think it'll be some time before we actually have vaccinated all of those individuals in all of those groups. After that, I think I would certainly defer to provincial authorities because they certainly are the ones that have the best knowledge of the epidemiology, what's happening on the ground. If there are certain areas in which are outbreaks ongoing, or there's a certain type of dynamic or situation that we at the federal level certainly wouldn't be aware of, we would certainly respect their analysis of the data in their own jurisdictions that would guide their vaccination. From a sort of an age perspective, as you mentioned with Dr. Tam, yes, we recognize that those at highest risk are in the older age groups, and certainly I think as a starting point, yes, you could start with 80-year-olds and then over, and then as a vaccine becomes more available, you could start going down to 75 and over, and then 70 and over, and so on. And so I think that as we ramp up, as Major General Fortin has said, as we get more vaccine, I think it'll become less and less of an issue because we will also have more vaccines to start targeting other groups as we are also start being able to offer at a provincial level to, let's say, age groups below 80. So I think in many ways, I would respect what Ontario is doing. I think they're making their best efforts, as with all provinces and territories, to really, at the end of the day, offer vaccination to all Canadians for whom the vaccine is recommended. Thank you.
Question. There was some positive news yesterday on the Johnson & Johnson vaccine. Dr. New, if you could just comment on that, and also any updates we have on AstraZeneca. And Major General Fortin, on the same vein, if AstraZeneca and Johnson & Johnson are approved in the second quarter, do you have any numbers on how many vaccines we would expect to receive from those two companies in that period of time?
I'll take the first part of the question, which is quite easy. As we've mentioned many times, we're not the regulators. Dr. Tam, myself, we certainly defer to sort of the independence of the regulators at Health Canada. I know, as you mentioned, for the Johnson & Johnson vaccine, also AstraZeneca, they made submissions, or sort of rolling submissions, as the data becomes available. They are submitted to our regulators at Health Canada, who are looking at them obviously quite closely. I know that they've brought additional personnel, so they're working sort of as fast as they can, but certainly without cutting corners. And I think it just remains to be seen that once they get all the data that they're looking for, that they'll come to a decision. So at this point, I don't have any further information in terms of what stage they're at or what the timelines might be. Thank you.
I think further to Dr. New's comment, we are expecting, as was announced in the past by my PSPC colleagues or Minister Anand, Canada has gone into a contract or has contracted additional doses with other manufacturers. When they become approved by the regulator and become available, then they'll be brought in the country and will be distributed. So we're aware of planning figures. I'm not going to disclose them at this time because it's subject to confidentiality agreements with the manufacturers, but it's part of the overall picture of hundreds of thousands of vaccine doses potentially in this country.
Thank you. I will now turn back to the phone for one question. For the next 20 minutes, we will do one question on the phone, one question in the room. So now back to the phone. Operator, over to you.
Thank you. Merci. The next question is from Lena Dib from La Presse Canadienne. Please go ahead. La parole est à vous.
Oui, bonjour, Dr. New.
Good afternoon, Dr. New. Let me come back to the question of the 42 days in Quebec. To see, saying that it's going to be 90 days. You've told us what the committee said earlier this week, that in exceptional circumstances we could go up to 42 days. If I understand you well, you're saying that if it's 42 days, if it's beyond 42 days, then the effects must be monitored. But now it's more than 42 days. What do you see? Answer. Thank you for the question. This is Dr. No here. Maybe I should summarize with the data we have available now, our National Advisory Committee on Immunization and also the WHO Expert Committee have arrived at the same conclusions when it comes to the interval up to 42 days for exceptional circumstances. We know what is happening in Quebec with the epidemiological situation, with the increase in hospitalizations, infections, and deaths. I believe that is a difficult decision. That is really a decision for the government of Quebec to make. What we are saying is that if a program, government or province wants to organize its vaccination program with an interval going beyond 42 days, it's very important to do proper monitoring, to collect data, to analyze the effectiveness of the vaccine in the course of the vaccination program for those who have received just one dose while waiting for the second dose. Thank you. Follow-up question? If I understand you well, all that will be done, if that is what Quebec decides to do, and that's what they've said, what we'll have to do is monitor the situation. I do not quite understand where how the citizens who are vaccinated will be protected.
Okay. Ce que je peux vous dire, c'est avec
what I can tell you is that
disponible,
with the data we have available, we know that there's a certain level of protection offered after one dose. But there's no 95% effectiveness, as is the case with the Pfizer-BioNTech vaccine. A second dose is required, ideally, with the data submitted to Health Canada after 28 days.
Avec les autres données disponibles,
with the other data available, our committee here in Canada, NACI, as well as the WHO expert committee, have analyzed the other data and have arrived at the conclusion that, yes, it is possible under exceptional circumstances to go up to a 42-day interval. But after 42 days, there's no data available to enable us to make a recommendation when it comes to an interval that is beyond 42 days. That's the case. I also believe that the public health authorities in Quebec, in principle, want to respect the 28-day interval. But considering what is now happening in Quebec, there's the other issue. They want to give greater protection with more people with a single dose. But with the data we have, we know that the level of protection is not going to be 95%.
assez haut pour peut-être permettre
maybe high enough
gouvernement du Québec de continuer avec
enable the government of Quebec to continue
axé sur
with a program that is focused on an interval of 90 days, as you say, but it's important for monitoring to be done, and the data will have to be analyzed, looking at Quebec's experience with vaccinating people with one dose. We also do not know how long-lasting the protection will be. We know it's better with 2 doses, but with one single dose, we are not sure.
Dr. New, we'll turn back to the room. Next question, Radio-Canada.
Oui, Laurence Martin, Radio-Canada.
Laurence Martin, Radio-Canada.
Sur ce sujet.
Just to conclude on that
si jamais
topic,
on a un cas, par exemple,
if
on
we
a
have
des
a
gens qui ont
case
reçu une
where
première
people
dose,
receive the
on
first
attend
dose,
90 jours et
we
là, on
wait
se rend
for
compte
90 days and we
qu'il y en a qui
realize
attrapent la
that
COVID-19.
they contract
Qu'est-ce qu'on fait avec ces gens
COVID-19.
qui ont
What
reçu
do we
la
do
première
with
dose?
those
Est-ce que
people
si on
who
leur
receive
donne
the
tout de
first
suite la
dose?
deuxième dose, ils seront là
If they
protégés ou peuvent
receive the
recommencer le
second
processus
dose
à zéro?
immediately, are
Qu'est-ce
they
qui se
better
passerait avec ces
protected,
gens-là?
or should they start the process from the beginning all
Je n'ai pas de réponse pour ça maintenant. Ça, c'est quelque
answer. I do
chose
not have
aussi
an answer for that question.
à discuter. Je pense
It's
que le
something
Québec
to be
aussi a leur
discussed.
propre
I
comité
think
aussi
Quebec
consultatif
also has
des
its
experts
own
sur l'immunisation.
advisory committee of experts on immunization. Right now,
de considérer, discuter,
they are
analyser
also
toutes les
considering
options.
and analyzing all options.
C'est quelque chose aussi à discuter aussi
I believe
avec notre
it's something we have to discuss with
spécial, mais pour l'instant, je n'ai pas de réponse.
Special Advisory Committee, but for now I do not have an answer. Normally, we think that the normal interval, with the normal interval of 28 days or 42 days, the probability of contamination is lower. But with an interval that is longer, we do not know.
Variant brésilien, là, je sais que le Royaume-Uni vient d'annoncer qu'il va fermer ses frontières à 15 pays d'Amérique du Sud.
Has announced it will be closing its borders to 15 countries of
Est-ce que vous allez faire la
the
même
South?
recommandation que le Canada
Are you
ferme ses
going to be
frontières
making the same recommendation that Canada closes its borders to some countries of the South, including Portugal? Answer. What I can tell you is that we are closely monitoring the situation in the world. It is normal
toujours en train d'avoir des mutations.
for the virus to continue to mutate. At some point, we know the criteria. We can say that it's a mutation that could have a certain impact on the population. We know that for the variants that have been observed in the UK, in England, it's transmissible, but so far we have not received any evidence to show that it's more severe. So it's a situation that, together with all Canadian laboratories, we are monitoring. Genetic sequencing is being done with all these strains to find out what is happening in Canada. And that may also be done with travelers coming back to Canada. With the first variant, all flights from the UK have stopped. But the policy here is that all those coming back to Canada by air must have test results on departure and upon arrival.
Donc, vous recommandez pas qu'on ferme les frontières.
So you are not recommending that the borders be closed? Answer. We are analyzing the situation. A decision has not yet been taken. What I can say is that there are many variants that may be reported throughout the world. So it is difficult to only look at specific countries. It is more effective, maybe, to have a program to enable us carry out testing at the border and also measures like isolation of passengers who come to Canada. So
thank you.
The whole series of measures.
Sorry, should I answer in English?
Go in English.
I think I just, well, I would say, the Brazilian variant, I would say, we don't want to tag countries. We'd say the variant that might have been first identified in Brazil, just as other variants have also been identified in the United Kingdom as well as in South Africa. What I would say is that we recognize from a sort of a scientific and epidemiological perspective that the virus, it's normal, it mutates, it continues to adapt to its environment. And so the emergence of variants is not unusual or unexpected. What we're obviously looking for is when there's a certain level, sort of a mutation in the virus that actually then has an impact at a population level in terms of, being a more virulent or, causing a greater disease. At this point, for some of the variants that we've sort of identified, like the one from the United Kingdom, it's more a matter that it's been shown, at least so far, to maybe be more transmissible, but really having no more impact in terms of the severity of illness. And so we continue to track what we should do for a variant, whether it comes from Brazil or the United Kingdom. We're certainly looking at all of the options. What we did initially for the United Kingdom variant was that we stopped all flights coming from the United Kingdom. And that was sort of, to be honest, in my view, a bit of a stopgap measure we had as we were able to take stock and analyze the situation. Now what we've done is that we have obviously the policy or the obligation for pre-departure testing, so that all air travelers coming to Canada have to have a pre-departure, PCR test, within 72 hours before their departure and arrival in Canada. So that way, it sort of takes sort of the banning of flights from a certain country, quote, off the table. And that's why we're now not targeting any individual country, but saying that all travelers to Canada, air travelers, need to have this test, or at least proof of that test before they come to Canada. So that, I think, is sort of the overall approach at this time, but certainly we'll continue to look at the situation and adapt as necessary. I think beyond sort of, maybe testing, there's obviously the quarantine that we require of all travelers coming to Canada. So really, I think it's various layers of protection that as a complete package will hopefully serve us in good stead moving forward. Thank you.
Thank you, Dr. We'll now turn over to the phone for one question. Operator.
Thank you. Merci. The next question is from Mélanie Marty-Lapresse. Please go ahead. Your line is now open. Votre ligne est ouverte.
Question from Mélanie Lamy, La Presse. Dr. New, to come back to the issue of the 42-day interval versus 90 days, from what we've received from the Chief Medical Officer, it seems clear that there was strong consensus or support for the 42-day option. I know it's not up to you to tell provinces how they should apply the strategy, but do you disagree with the decision taken by Quebec to opt for 90 days? Answer, it's not for me to agree or disagree with any province or territory. I can tell you exactly what you said. There's strong consensus among chief medical officers of all provinces and territories. Everyone ideally wants to follow the recommended interval as recommended by the manufacturers, Pfizer, BioNTech, Moderna, and also Health Canada. In some provinces, for example, the Atlantic provinces like Nova Scotia, it's not the same challenge. It's easier. I believe they are still following the recommended interval for doses, but in some provinces like Quebec, the situation on the ground is different, looking at the epidemiological situation. So the public health officials and the government of Quebec have other considerations. They will take their decision when it comes to the interval for doses. It's a decision that is up to them. But looking at the scientific data, it's only under exceptional circumstances, and we insist on the fact that it's better to do proper monitoring to find out what will happen in the weeks and months afterwards. Thank you. Follow-up. Let me move on to something else that was in the committee's report. The possibility of mixing doses. For example, someone who received the Pfizer dose first could receive a Moderna dose afterwards. Since it's the same mechanics, what do you have to say about mixing the same doses? Mixing vaccines. Answer. Thank you for the question. I'm not an expert in epidemiology and on vaccines. I also go by the advice given by experts. What I've seen is that what is being recommended is that it's better for people to continue with the same vaccine. If you receive a first dose from Pfizer, BioNTech, it's better for you to receive the second dose from Pfizer, BioNTech. With Pfizer, BioNTech, we see that it's the same types of vaccine, RNAs, and there's another aspect that has to do with the science. Scientists may have done other analysis, but to date, I always like to look at what the evidence says. It is ideal, in my opinion, to respect the interval and use the same vaccine we started with.
Merci, Dr. New. We'll turn back to the phone for one question. In the room for one question, Charles Starr.
Hi, Dr. New. What are the exceptional circumstances and the data that supports recommending that you can change up the interval? And has there been any discussion or offer by provinces where they don't have as bad a problem to share their doses so that other provinces like Quebec can actually get their dose intervals done on time? For example, you talked about the Atlantic bubble. So essentially, it seems to me you're giving license to all provinces to just vaccinate whenever they want.
No, I can say that we've had a very good discussion with all of the chief medical officers of health, and I think you raise a good point, Tonda, and I think it needs to be stressed that all of the chief medical officers of health, there's a very strong consensus to follow the schedule, and ideally it is the 21 or 28 dose interval for the two vaccines that we're talking about. And certainly I can't speak for the Atlantic provinces, but their they're committed to following the schedule as approved by Health Canada and the manufacturer. Other provinces are as well, but the fact is that in certain provinces like Quebec, I guess the exceptional circumstances you're referring to, I think, are exactly what we've said, I think, several times here. It is sort of the interplay between the actual epidemiology on the ground, the fact that there is obviously increased rate of cases, hospitalization, deaths. There's certainly a more widespread sort of transmission at community level in certain parts of the country. And as we said, at the present time, there's a limited supply of vaccine. And so in terms of looking at it, even from an ethical perspective, I think that those are some of the considerations, whether in a given area, if you have to have this challenge with so many cases and so many hospitalizations, is it maybe a different or better approach, maybe from their perspective, to give one dose with a certain level of protection, based, of course, on what the scientific data has shown, to give a larger number of people a certain level of protection, as opposed to a smaller number of people and giving them that higher level of protection with the 2 doses with the recommended interval. And so I think that's something that I think Quebec has its own, immunization, a sort of expert committee that also will be giving that government its best advice in terms of how to proceed forward. So that's all I can say at this time. If you look at the statement that's come forward from the chief MOHs, I think hopefully it does capture the spirit that everyone is committed to doing the 2-dose regime as best they can, following that sort of a recommended interval.
And then what's to stop? Like, are you not essentially giving tacit permission to any government in Canada, say for out in Alberta, where they're having spikes in long-term care homes? Are you not actually saying to the political leaders, go ahead, take for up to 40 days, vaccinate as many people as you can? Like, where's the science in all of that?
I'm not sure. From a public health perspective, I don't think we're giving any advice to political leaders. We're obviously within the public health community. We're looking at the best science available. What the science shows, and I think the science is there that shows that even what the manufacturers first submitted to Health Canada, that there's a certain level of protection after 1 dose, and obviously a much better protection after the 2nd dose if it's given within in this, I keep repeating myself, the 21 or 28-day interval. There's also, I think, enough evidence that if you look at some of the exceptional circumstances from a strictly scientific point of view, public health point of view, that also takes I think maybe even an ethical perspective, that the public health experts and authorities are also looking at whether that interval can be increased. And based on the available data, both at the international level with WHO's expert committee and our own NACI committee, they said that it is reasonable to be able, preferably within the 42 days. And that's all the scientific data we have at the present time. I will say, and I said it, I think, in French, is that not to put sort of too fine a point on it, our experience with other vaccines and just with sort of immunology in general, and I'm not an immunologist, so I won't claim to be an expert, is that if you're looking at a vaccine that has a dosing schedule with a number of doses, what's more important is to respect the interval and not go with a shorter interval. So let's say if there's a vaccine, I'm looking at some of the childhood vaccines where the dosing schedule is like, 2 months of age, 4 months of age, whatever. If it's a 2-month interval between, let's say, dose 1 and 2, you should not go shorter than that, because then the effect might not be as good. But if you were to extend it by, a week or so, or, a longer period of time, overall, that should not affect. And in some cases, actually, for younger populations that are able to mount a stronger immune response, you actually get a better effect in terms of a long-lasting immunity. So I won't venture further because I'm not an immunology expert, but I think the principle of increasing a dosing interval, I think, is not as problematic as decreasing the dosing interval based on the science and what we know about vaccines in general.
Thank you, Dr. New. That time is running out. We only have time for one more question on the phone. I'll turn it over to you.
Thank you. Merci. The next question is from Charlie Pinkerton from iPolitics. Please go ahead. Your line is now open.
Good afternoon. Thanks for doing this all. I also have a question related to Johnson & Johnson and its vaccine. I understand what General Fortin said about not being able to share details about the delivery schedule, but I am wondering if it is approved. The company expects that it would be approved in the U.S. and be able to be rolled out by March. So if we operate in a similar way here in Canada and it is approved, would that company's delivery of 38 million vaccines speed up the timeline that we have here in Canada, trying to get every Canadian vaccinated with at least one dose by September?
Yeah, thanks for the question. To be clear, we do not have a delivery schedule for Johnson & Johnson. We have an amount that's being contracted, so purchased, pending regulatory approval. We have no control on that. It's a Health Canada regulatory approval process, so it's arm's length from those who actually do the rollout, clearly, and independent of what regulatory approval process take place in other countries. So I really can't speak to delivery schedule. I can't speak to dates, quantities at this time, because it's still being negotiated. But once regulatory approved, once available, then quantities that Canada expect to receive will start trickling into the country.
Follow up?
Yeah, I think I still don't understand entirely. I guess what I'm trying to ask is, will the government's timeline for getting every Canadian vaccinated be sped up by whether it be Johnson & Johnson's vaccine or another companies who we have a deal with? Will that, if any of those are approved, would it improve that timeline?
It depends. So I would just highlight or emphasize what the Prime Minister mentioned. We have 80 million doses coming in this country over the next year. With a significant increase in April onwards, and again in the summer timeframe, of both currently Health Canada approved vaccine candidates, Pfizer, BioNTech, and Moderna. And as additional vaccines come approved, are part of Canada's portfolio, become available, they were brought in the country here and be added to the mix. I really can't comment further on when that would be and if that will happen in the short term. That's really, I would be speculating at this point.
Thank you.
Thank you.
Major General Fortin. Unfortunately, that's all the time that we have today. Thank you very much. That will conclude today's press conference. Thank you.